My name is Joshua Meza. I'm a mental health nurse practitioner. Outside of work, I enjoy spending time with family mostly. There's a trail near our house where blackberries and thimbleberries grow wild. So during the spring and summer, we tend to go on a walk pretty much every day, head over to the park and just spend some time outside. My areas of specialization tend to be kind of a mix of ADHD and mood challenges, so depression, bipolar disorder, and anxiety. I find that most of the folks I work with are coming to me for help with ADHD or depression and anxiety. And so those are kind of the topics that I've leaned towards and what I specialize more in. Historically, I have worked with a lot of folks who are dealing with psychosis and sort of bigger mental health challenges. But in my current role, I don't have a lot of bandwidth to help with that. So I'm mostly focusing on ADHD, anxiety, and mood challenges. My original education was in early childhood development and family sciences. And from that bachelor's education, I really developed a love for developmental psychology and was actually a preschool teacher for a couple of years before I went back to school for nursing and then to get my graduate degree to be a nurse practitioner. And what kind of led up to that is as I was working as a preschool teacher, I recognized that I was really gravitating more towards the children who had special needs or emotional and developmental challenges and wanting to spend that one-on-one time with them. And that's actually what motivated me to go back to school and pursue being a mental health nurse practitioner. So the moment it clicked for me that I wanted to work in mental health and behavioral health was I was working with a young kid as a preschool teacher. I think he was about 4.5 years old. And he was living with autism spectrum disorder. And he was very into sauces. He had his sauces set up. He always had to have his sauces at lunch. And it took a while for us to figure out how to get him to eat was to give him an array of sauces. And I feel like I was a big part of sort of figuring out what we could do to get this young man to eat and what would make him more comfortable. And sort of that digging in and finding the specifics and the niches of what's going to help this person feel more comfortable and happier in their day-to-day life. And it's something as simple as eating lunch. It felt like a really big victory to me. And it sort of made me feel like that's more what I want to do. I want to help more the individual who's struggling rather than manage a group. Outside of therapy and medications, treatment, the best things you can really do for your mental health is exercise and eat a healthy diet. It sounds pretty hackneyed to hear that again, but 30 minutes of exercise 4 or 5 days a week, even just a walk or some lightweight lifting, getting out and going for a hike is hugely beneficial for anxiety and depression in particular. And then healthy diet, a varied diet that's got lots of fresh fruits and veggies in it. And there's nothing that's bad for, and lots of things it's good for. Mental health in particular really responds well to a good healthy diet and giving our body the nutrition and fuel that it needs. So outside of sort of treatments, just healthy living and things you can do to get yourself feeling better, get outside, get some sun, and get some veggies and fruits in your diet. A self-care practice that I utilize every day is I try to eat a healthy diet. So I try to have some fresh fruits for breakfast. I try to have some vegetables for dinner. Lunch is always kind of whatever's there, I guess. But as far as what I do, I really try to practice what I preach and eat a healthy diet. And I do try to exercise at least 4 days a week. Even if it's nothing big, just getting out for a 15-20 minute walk or going on a little hike with my daughter. Those are the ways that I really try to take care of myself in the day-to-day. Some small and realistic goals to help managing anxiety in day-to-day are sort of outside of healthy diet and exercise, which I've said a few times. Taking a moment recognizing when the anxiety is starting to kick up and recognizing situations where the anxiety is typically going to start to be more problematic and working on things to help balance yourself and center yourself in those moments. I think a lot of us have heard about breathing exercises, grounding techniques, and those can be really great in the moment, but they don't work for everybody. And really that recognition of when the anxiety is starting to become problematic or recognizing those environments where it will predictably become problematic is huge, in that you can then practice those different skills and find what's going to work for you. So does grounding work for me? Does breathing work for me? Or is this the type of situation where I need to get up and go for a walk or take a break from it or engage in a hobby of some kind? Something to help in that moment once you've recognized that the anxiety is starting to become problematic can be very helpful.